episode. We have, I mean, every week is an expert. This is just an expert on a level that is beyond. And I'm so grateful that Dr. Couëtil is with us here tonight to talk about the equine respiratory system. We were chatting before we got on here and really just agreeing that so many riders and horse owners want to do what's best for their horse, but oftentimes there are misconceptions or just they don't have all of the information. And this is one of those conversations that is going to open your world up a bit to help you do even better for your horses. So I can't wait to get into it. But first, Dr. Couëtil, thank you so much for taking the time to be with us tonight.
Yeah, my pleasure. Thanks so much for the introduction, Jess. Yeah, I'm very excited. As I mentioned earlier, Dr. Ivester, when I told her that I was coming on your podcast, she was jumping and super excited. So yeah, I look forward to the question and so forth. So you asked me to give a little bit of my background. So as you can hear from my accent, I'm originally from France. I grew up in Normandy, so it's a big region for horse breeding, and I grew up indeed on a small farm where my family was raising race horses actually, so brood mares to go and eventually run on steeplechases and things like that, and so naturally. I encountered many veterinarians that would come over and check out the horses, the brood mares, the foals, etc. And so eventually, that was my chosen path. I went to vet school in France, in Paris, and then I went to in private practice north of Paris, a town called Chantilly, which is kind of a big thoroughbred training center. There's also a big racetrack there, and I worked there for several years, for 6 years actually, and then I felt that I needed to do something different. And a lot of the literature I was reading, actually, I didn't have time to read many journal articles at that time, but they were coming from American University for the most part. And that really sparked my interest to come over here and explore. And eventually, to make a long story short, I ended up doing a residency in internal medicine at Tufts University in Boston. I just met great people and mentors there that really gave me the respiratory bug, in particular, Dr. Andrew Hoffman, and that really. From that time on, I wanted to continue in an academic environment that just was very stimulating to me. Um, what was new, obviously, for me was working with vet students, and that was exciting. But also just the ability to both, see patients on a referral population and then design studies to try to answer questions. To me, that was exciting. So that's how I looked for essentially an academic job after I finished my residency, and Purdue University was my first academic position, and here I am almost 30 years later, still at Purdue. So somehow I must have enjoyed it quite a bit to stay here. And indeed, it's true. I'm still excited to do what I do. So that's kind of my background. And then in the meantime, I also did a PhD in respiratory physiology because I felt I needed some more advanced training along the way. So here it is.
I told you guys this is an expert and beyond. Your experience is incredible, and I'm really excited to dive into some of the things that you have studied and continue to study, and just your depth of knowledge on the topic. I know that you started in a racetrack environment. Ha, has your studies continued to be kind of centered around racing or sport horses, or are you kind of discipline agnostic?
Kind of discipline agnostic, I would say. And actually, I did ride myself, more when I was in high school, and so did, more show jumping and eventing and things like that. So I've been exposed to a variety of disciplines and not just racing. But it's true that the racehorse is kind of the ultimate athlete. It has to have an impeccable, locomotor system, of course, cardiovascular, but the respiratory function has to be up at 100% to be able to deliver performance. So that's always been interesting to assess this horse. But we've studied many horses that were just also regular sports horses. We've done studies, especially with patients, that would come to the clinic that we recruit for studies. So, kind of real life situations. And we are also planning future studies in sports horses as well. So it's really depends on what kind of question we want to answer.
Hmm. Will you maybe just to kind of ease us into this topic before we get into some specifics? Will you talk to us about some of the most common respiratory conditions that you see and distinguish whether these are genetic conditions that the horse is born with or
Mhm.
conditions that come about because of the horse's environment or maybe their workload?
Sure. So my area of research is asthma in horses. So you may have heard about heaves, which is really or broken wind. It's really kind of the extreme end of the spectrum in terms of asthma severity, where these horses really have a hard time just breathing at rest. You can see their flank pumping and their nostril flaring, and but there are some much milder form of that disease, and that we used to call kind of inflammatory airway disease, or IAD. You may have heard that terminology, and now we're calling that more mild moderate asthma. And we use the term asthma that people have been reluctant to use for many years when we were talking about horses for various reasons. But now that both the knowledge of asthma in people and in horses has evolved, over the past, 10, 15 years, recognize that asthma in people has many different forms. You have asthma in children, tends to be, what we call atopic or allergic asthma, with certain type of cells called eosinophils, for example. And then you have also an adult onset asthma in people, where it's more common to see neutrophilic inflammation, for example. And to the same token, in horses, we've also come to recognize different forms, and yes, in the mature kind of older horse, we see more the severe asthma phenotype, we call that, so the heavy phenotype. But this is really kind of the tip of the iceberg, if you'd like. We still see about 14% of horses, especially in kind of what we call northern cool climates, meaning horses that, are in the barn in the winter, all closed up eating their hay. And so that's how common it is in those regions. But we also see a severe form of asthma in the southern states in the US, in Florida and Louisiana, where these horses are actually showing signs on pasture in the middle of the summer, in June, July, and it's because they're exposed to trigger in that environment. But the most common form of mild asthma is actually in a whole range of more younger athletic horses, and it's very common, but it's pretty subtle. Sometimes horses might cough, but they don't necessarily cough, and it might be just more manifesting itself as poor performance or prolonged recovery after exercise. So it's often, subclinical, essentially a little bit hard to detect at times, and certainly poor performance has many causes. Your horse can be sore, can be lame, can be having some a variety of other conditions. So it's important to really work out the issues. And as far as other respiratory diseases, obviously, there are many infectious causes of respiratory disease. We are well familiar with the influenza, of course, and rhinopneumonitis, for example. So viral diseases still happen. And then you also have pneumonias, bronchopneumonia, pleuropneumonia, so different form of bacterial infection that affects more the lungs, if you will. And so those horses with infectious disease, either viruses or bacteria, you typically detect them pretty quickly because they really feel bad. They don't eat very well or drink very well. They'll have a fever typically, and so so those we tend and the astute owner will pick it up very quickly. We'll take a temperature and realize, well, this horse has a fever. I need to call my vet and go from there. Whereas all these asthmatic horses, they really don't feel bad. They don't feel sick. The problem happens often when they have to exercise. So they don't have a fever, they eat well, they actually can train well for horses with mild moderate asthma. The problem comes on usually when they have to perform, because that's where they feel their limitations. And obviously, the severe asthmatic horse, you can see it that it's got difficulty breathing, and those are typically very chronic cases that have been going on for months, sometimes years. And so these are kind of the big categories of respiratory diseases, and haven't touched upon, upper airway issues, with horses that are roarers, may have, laryngeal hemiplegia. You have a lot of other conditions as well.
Is asthma a genetic condition?
So there have been quite a bit of studies to investigate that, and for severe asthma, that's where most of the studies have been done. There are essentially a subset of horses where there's definitely a predisposition. It's been shown for some lipid for example. So if you have a lipids that could be a case, and also for some warm bloods, and actually different type of genes have been implicated. And in those particular families, if you have just one parent affected, either the stallion or the mare, the chance that the offspring will suffer from hives, for example, goes up like threefold or so. But if both parents are affected, the odds, go up, considerably more, like, five or sixfold. So yes, for some horses, that's definitely been shown to be the case, but it's actually more the minority. Um, so it's just a subset of horses where you can link that to some genetic traits.
Interesting. So you're saying that asthma could be kind of either. It could be
Hmm.
something that is inherited, or it could be something that is brought on due to environmental factors. I
Absolutely.
didn't
Like
know
in
that.
people, actually. So we call it multifactorial. So you have some kind of genetic background that might predispose the person to have asthma or the horse to have asthma. But you're also a whole lot of other factors, typically environmental exposure factor, but also prior infections, for example, and things like that, that
Okay.
will be important, as what we call risk factors to develop asthma.
And when we think of respiratory issues that do not fall into the viral or bacterial categories, is asthma the most common that would affect a horse?
Absolutely. Yeah, by far. Yeah. And I think, especially as we will recognize that um, it's under recognized essentially, because it is subclinical, because it is, essentially the signs are pretty subtle, as I mentioned. They may not cough, even though they have a lot of airway irritation, inflammation. Um, and again, poor performance can be caused by many other factors, so other problems. So it is, I think, much more common that we think. And so that's something that hopefully people will be more aware of this. And when their horse is not quite right, it should be on the list, at least, of potential, causes to investigate.
Interesting. And does every horse with asthma, kind of regardless of where they are on the spectrum, deserve to have or treatment of some sort, or like an adjusted workload because they have asthma? Like,
Hmm.
asthma is not something that ideally would just go untreated, unacknowledged, regardless of where it is on the spectrum.
Yeah, so to answer your question, no, not all horses need to be treated if they do have asthma. First of all, there's a gradient, a spectrum, as I mentioned, from mild to severe. And I guess the example I would give you is you may have some brood males that have low-grade asthma that might cough once in a while, but they'll be completely able to, keep up their body weight, bring their foal to term and nurse allow the foal to nurse normally afterwards. And so I've seen even horses with more severe asthma, brood males with more severe asthma, still being able to do fine. So it really depends on what the horse is doing. The more intense and strenuous the exercise, the more completely 100% healthy the respiratory tract has to be. The other analogy would be, do you treat laryngeal hemiplegia, the cause of roaring, for each horse with a paralyzed larynx? Well, no, because again, the noise and the airway obstruction is manifest during exercise. And, a dressage horse that typically will exercise at what we call kind of 50% of their maximum, aerobic capacity. Um, the only reason we do surgery typically is because of the noise, but the horse is not necessarily bothered by the degree of airway obstruction. Whereas if it's an eventer or a racehorse, of course, then you will have to do surgery because the airway has to be back to, full diameter. Otherwise, the horse can't compete. So there are a lot of factors that really will affect whether or not the horse will have to be treated. Its asthma will have to be treated.
And roaring is does not fall under the asthma umbrella, correct?
Yeah, correct. Yeah, this roaring is really the throat essentially, so the upper airway, and what we are talking with asthma is really the lungs.
Okay, that's a great distinction. And then, not to sidetrack us, but just because roaring was mentioned, am I correct in repeating back to you that if a horse roars
Hmm.
and they're being used for something that is demanding when it comes to their aerobic exercise or endurance, surgery is always necessary for them to keep up that
Yep,
event?
typically, and the type of surgery will differ will depend on what this horse is doing. So if it's a racehorse, well, typically we would do what we call a tie back. So do a shear surgery where you know, kind of pull back that cartilage to replace the muscle that's paralyzed. But if it's, let's say, a draft horse used to pull, and um, we might just take out the vocal cords, do what we call a vocal cordectomy, which can be done standing with a laser, and under endoscopic guidance. So the approach is quite different depending on what the horse is doing and with the degree of paralysis as well. So it's not one size fits all.
Okay, that's helpful, and you're masterfully segueing us into some of these questions. I had a couple of questions from members about laryngeal paralysis, and Paige specifically said, if your horse has laryngeal paralysis, at what point in his career is it important to have tieback surgery? And I know, could you distinguish between laryngeal paralysis and roaring, and then talk to us about when tieback surgery is necessary?
So roaring is really referring to the noise that the horse is doing when there is laryngeal paralysis. That means that size of the larynx is paralyzed, and essentially it's causing an obstruction to airway when the horse is breathing in because the muscle in the larynx is supposed to keep all the airways maximally open. and typically it's on the left side that the paralysis occurs. And so when the horse is breathing in, can't open up that cartilage, and think of it a little bit like a curtain. You can't really open the curtains fully when the horse is breathing in. So that uh, one side of the curtain will float in the middle as the horse is breathing in at very high rate, and that makes a lot of vibration, and that's what's causing the noise, the roaring noise. Okay, so essentially it's the same thing as just the terminology. One is scientific laryngeal, paralysis, versus roaring is kind of the layman's term for the condition. But the approach again depends on, as I mentioned, on what the horse is doing. How intense is the exercise this horse is supposed to do, and at what level it's supposed to perform. But there are definitely different approaches to fix that larynx based on what that horse needs to be doing. So if it's again a race horse, you'll want to do a tie back. If it's a dressage horse, you might do just a vocal cordectomy, again, just removing the vocal cords. And then sometime there are, in the horse, actually, the race horse, we do both the tie back, and we remove the vocal cord as well to make sure that
Wow.
everything is nice and tight and fully open. Yeah.
So the two members who were asking about this, Paige and Kristen, I believe they're both event riders. I'm quite certain Kristen is an event
Hmm.
rider. And she specifically said she was told that her horse was slow on the pre purchase exam, but it doesn't seem to affect him. And she's again talking about laryngeal paralysis. She said,
Hmm.
how do I know if it's time or if he's struggling? So, how do you guide
Yeah.
people on that aspect of it?
And that's an important question because there's actually various degrees. The horse doesn't become paralyzed, that larynx doesn't become paralyzed from one day to another. It's a whole progression. So you actually have degrees of paralysis, and we grade that paralysis. So, for example, a grade 4 is complete paralysis. So you can imagine you have one, two, three, and even with a grade 3, for example, you have a 3A, B, and C. And where that's coming from is it's really important to examine the larynx while the horse is exercising. Because a resting endoscopy, yes, it will tell you if it's completely paralyzed, but if it's in between, it's really hard to predict. So nowadays, a lot of veterinarians have what we call overground endoscopes. You may have seen those. You actually pass the, it's a shorter, usually endoscope that's kind of curved, that you pass in the nose to visualize the larynx, but then the whole endoscope fits on the horse's bridle typically. And so you can then either ride the horse or launch the horse while you are examining the larynx and looking at it. Some system you can have a tablet that you can look at, from a distance. The vet will be looking at that as you exercise the horse. So that's really the best way to gauge the need for surgery and what type of surgery. Because there are sometimes some complicating factor. You may have multiple upper airway obstruction. It's not just laryngeal hemiplegia. You can have, epiglottic entrapment. You can have really a dorsal displacement of soft palate. You may have a lot of other condition with it that require to be addressed as well. So when I first started, actually, I came to Purdue because they also wanted someone to start their equine sports medicine program. So they were planning to buy a high-speed treadmill and so forth, which they did shortly after I arrived there. And when we were doing evaluation of mostly racehorses at that time, it was with the traditional endoscope that you have your endoscope in your hand and you're tethered to the light source and a big tower, and you've seen that probably in vet clinics. So we had to wheel that next to the treadmill, get the horse warmed up, then pass the endoscope and get going, and you had that one shot to, to look at that. Nowadays, and even when I do it on the treadmill, I use also those portable, wearable endoscopes. So it's much safer for the horse and for us as well. And also we can, either look at the horse on the treadmill or look at the horse being ridden, because it's really important to, especially for eventers or dressage horses, to look at the change in the upper airway function with the head position, head and neck position. When you collect your horse, you tend to see a normal decrease in the airway size. And then some of the prime can happen at that time. So looking at that function of the upper airway uh, while the horse is doing what it's supposed to do, it's really the best way to find out what needs to be done.
Wow, that makes so much sense, and it's very cool to hear how the approach has improved since you started,
Mm-hmm. Oh yeah,
um,
very much so.
working on this. Yeah, that's a
Mm-hmm.
huge improvement. Tell me, for somebody like Paige or Kristen who has a horse that they know has an upper respiratory issue, is it important to work with a veterinarian who specializes in respiratory issues, or is it something that kind of every your vet for everything else will likely be able to guide you through? What would your advice be on that front? And are there certain instances where it would be more important to get someone who's specializing?
Yeah, I think someone that really specializes in these issues is really important. First of all, they are more likely to have that type of equipment. It's again costly to buy these overground endoscopes, so you're more likely to have those folks that specialize in sports medicine. To have that and being used to looking at the recordings to be able to say, well, this is the problem. I mean, for example, these the horse at full speed, will take 2 breaths per second. So things go extremely fast, and you may miss something unless you play the video back, in slow motion and look at what's happening during inspiration versus expiration. That's really the where we learned a lot, reviewing those videos, because there are things that you can miss. I've seen horses with just epiglottic fold collapse, where you see that hourglass shape, larynx, and it just happens at peak inspiration. Expiration, you don't see it. So when you look at the video in real time, it's really not obvious what the problem is, but you look at it, breath by breath, and then, oh, of course, and the treatment for that is very different from what you would do for laryngeal hemiplegia. So it's really important to work with people that are used to do those kind of exams. And the other thing that I would say is, for example, for upper airway obstruction, some nice studies have shown that horses are also much more likely to have asthma concurrently with the upper airway obstruction. The link is not quite sure. It's likely that you have asthma, meaning a lot of inflammation in the lung. You'll have very likely also upper airway inflammation, and that makes presumably the obstruction more likely to develop. So you don't want to just treat one thing and leave the other problem um, not addressed, because then you just fix half of the problem, and your horse won't be back to its full potential. And I've seen that over the years. Actually, when I started the sports medicine program at Purdue, um, the key was to do a really a standardized test where we evaluate everything, not just the locomotion, not just the lung function, not just the upper airway, but also the cardiovascular status, the muscle. So we did all the testing in those horses coming in, and we learned a lot. We learned that basically um, 80% of horses had multiple problems. They can be tying up, and they can have, upper airway obstruction. They can have asthma as well as an upper airway problem. They can have cardiac issue. I mean, it's very interesting to take that approach. So because sometimes the complaint was okay, my horse is not racing as it used to be, and but there was
Mhm.
no complaint of noise, or so how do you approach that? Well, the approach in my mind was, well, let's evaluate all the body system that matter for optimal performance. And that's how we learned a lot, I guess, doing so.
Yeah, that makes a lot of sense and is incredibly helpful guidance for people. And it also, I think, it helps people set their expectations in terms of what sort of testing will need to be done in order to get a full picture and a full diagnosis and treatment plan. Um, it sounds like it needs to be pretty comprehensive in some cases, and at least if you're trying to get the whole picture.
Yeah, I think so. I think sometimes you have really good directions given by the signs that the horse is showing. Okay, this horse just started coughing. We tried, we treated for infection and for a couple of weeks, and then the horse is still coughing and not performing well. Then you think it's more likely to be, the lungs and the lower airway. Um, Sometimes the horses, make a noise, abnormal noise when they exercise. So then obviously you focus on the upper airway at that point. Uh, but sometimes it's really ill-defined. I mean, I have a lot of uh, people that will bring the horse. They say, yeah, he's not performing as well, but the issue is it takes a long time to recover after exercise, huffing and puffing for longer than usual. But that's it. So, this could be, could be pulmonary, could be cardiovascular, could be, musculoskeletal as well, and things like that. So it's important there to have kind of a broad approach and make sure you don't, come in with a tunnel vision, I call it, where you say,
Mhm.
okay, it's got to be asthma, for example, or it's got to be this, and so it's important to keep an open mind. And I think, as a practitioner, we tend to often focus because with experience you've seen many horses, with that kind of, navicular or, upper airway obstruction, and so you don't want to, waste the owner's money as well. You want to be efficient, and I think, 90% of the time that works. But there's 10% of the time where that horse doesn't fit the mold, and so it's fine to have the tunnel vision initially, but then you have to recognize and step back and say, well, okay, so it's not, laryngeal problem. Um, I need to figure out, okay, why is this horse not performing? So now you need to open your mind to other possibilities, and so that's where you need to change your approach at that point.
Understood. Okay, super helpful. I want to circle back to asthma because,
Hmm.
like you said, it's one of the most common issues horses are dealing with when it comes to the respiratory system, and because you have done so much research in this area. Um, to start, I guess, restart, is it correct that what unites what unites everything under the asthma umbrella is inflammation in the lungs, or is there something else that defines asthma?
Yeah, it's inflammation in the lung that's not caused by an infection. And so, and typically what happens is it's a range of severity, of course. So the severe one, on one end, the heavy horses, that inflammation's been going on for a long time. And then there are a lot of changes, what we call remodeling, that happen in the airways of these horses. And that makes them more likely to kind of narrow down these air tubes, like in people with asthma, you have difficulty breathing because your air tubes in the lung become very small. So it's much harder to breathe air in, but also to push air out. So that's why the, albuterol, for example, or bronchodilator, opens your airways, and you can breathe much easier. Um, but that doesn't address the inflammation. The inflammation actually is driven by what the horse is breathing and exposed to, and that's floating in the air. And that's really dust, and dust has many components. There are so-called just Irritants, so non-specific things that can irritate the airway. So particulate matter, for example, that's floating in the air, but also you have molds that can elicit more of an allergic type response. And then you have other things that can make the response stronger. For example, dust is not a sterile, compound. There are a lot of bacteria contamination, and part of bacteria is also what we call endotoxin. And we know that, for example, endotoxin potentiates, so essentially makes the response to any particular type of dust stronger when you have that kind of contamination to dust particles. And also, what we've learned is the size of the dust particles is really important and key. And that's really well known in human, especially what we call occupational medicine. And people have designed different type of sensors to detect, particles of particular sizes. And when we started, actually, Dr. Katie Ivester, we were talking about her earlier on, her PhD was really using those sensors in horses. And essentially, she was the one to first show that what we call respirable dust, so a dust particle less than 4 micron in diameter, was the one that was causing or associated with airway inflammation in horses. But if you look at the larger particle sizes, 100 micron and below, so 100 micron is essentially the diameter of a human hair is about 50 to 100 microns. So those type of size particles, you start seeing them, but the very small one, the respirable, you actually don't see them. And she found that the larger particle that you can see actually don't cause inflammation and were not associated with inflammation. So I think that's important to know. When if you go into your barn and you have that sun ray that like I had earlier that shine through, and you can see right away all the dust particles shining. Um, those are the large ones. Those are not too terrible.
Wow.
Um, the one that you don't see actually are the one that cause that inflammation in the lungs. So that's really why it's important to not assume that everything is clean because you don't see the dust.
Yes.
So that's
Wow.
that's a problem. Yeah.
Counterintuitive,
Mm-hmm.
and very good to know. There's so many directions I want to take this. I want to talk about identifying asthma, preventing asthma. Um, let's let's keep going kind of on the prevention because it sounds like this dust could is a factor. So
Yeah.
these small dust particles,
Mm-hmm.
what can we do to make the environment that we are putting our horses in um, more free of these dust particles? Is that even possible? What else should we be thinking about in our horse's environment to prevent what would cause inflammation? And I also, sorry for a long question here, but will you clarify for me whether these dust particles that cause inflammation, does that mean that it's causing asthma or does that mean that it's causing kind of like a flare up of asthma that already exists?
Yes, good question. So to start with, those dust particles in the severely asthmatic horses, the heavy horses, yeah, it would cause a flare-up. If you expose them to sufficient level for long enough, they will flare up. So, and the classic cause of flare up is you feed them hay, dry hay, and that really contains, particles and molds. Even good quality hay. That's again another misconception. My hay is very good quality. There won't be molds in there. Yes, there are molds in there. It's just obviously if the hay is moldy, that means the condition were right for those mold to grow and multiply. So you'll have much more. But molds are part of normal, even good quality hay. So in a heavy horse, again, to go back to that, yes, indeed, if you expose them, that causes flare up. But in a healthy horse, you expose them to a dusty hay, uh, and within a matter of few hours to a couple days, they will develop a reaction and inflammation in the airway. The Actually, the classic example that we do all the time, even in research, to trigger that is you take a horse that's been on pasture and then you bring him in a paddock and feed a round bale hay. Um, the round bale, if you've seen horses eat the round bale, they often bury their nose in there, so they get exposed to much higher level of dust compared to feeding, a small, square bale of hay. And we know that that will rise their level of inflammation, very quickly. And if you then replace that round bale and feed them a pelleted hay, for example, or hay cubes, you'll see that inflammation come down, within a few days or weeks. So so yeah, it depends on whether or not they have a severe form of the disease or not. But even for the mild one, just exposure, and especially what we found in our research is certainly hay is the biggest source of exposure to dust. So for a
Okay.
long time, we said, okay, it's the barn that's poorly ventilated, it's the straw bedding, that's bad. It's um, We always knew that obviously moldy hay was bad, and that still remains the case, no question. Um, but what I'm saying is, even with good quality hay, um, often what will make your horse flare up and develop asthma is really more the hay than anything else. And we know that now because we've developed some sensors, small sensors that are portable that we actually attach to the horse's halter. And it just essentially measure dust in their, what we call their breathing zone. So essentially their um, the air bubble around their nose, not a bubble, of course, but when they take in a
Mhm.
breath, they inhale all that, air that is around their nose. So that's really what you want to know is what they're exposed to, and not just in the middle of the barn. And actually, that was another study from Dr. Ivester when she measured the dust level in the barn versus in that breathing zone of the horses. What she measured there could be related exactly to the airway inflammation of the horses. When she measured in the barn, I had no correlation, no association with the inflammation of the
Wow.
lungs. So this is really because most barn actually pretty good in terms of controlling dust level. What you really is harder to control is what the horse is exposed to when they eat the hay, because they have to have their nose in there. You know, their lips have to prehend, that hay, so they have to get their nose in there. But as a side note, for example, in her study there, she also compared horses that were fed hay in the stall in a hennet versus the hay put on the ground.
Mhm.
And very interestingly, when you measure dust exposure around the nose like that, she found that horses eating from the hennet were exposed to 3 to 4 times higher level of those small dust particles, respirable dust that cause asthma, compared to feeding on the ground. So just
Wow.
simple things like that can help. So obviously that means hair racks also are not optimal. They'll result in horses being exposed to much more dust particles. And that kind of makes sense because the horse, is eating from the hair rack or from the hennet, and essentially it's at the level of its nose. So even if it grabs a couple bites, they usually will stay kind of near. And then so you'll have that cloud of dust that will remain there. Those particles are so small that they don't settle down very quickly. So the horse would breathe in much more. Versus on the ground, you see horses take a bite or two and then they raise their head and then chew, and then they go back and grab another bite. So they move away from that kind of cloud, if you will, that they create when they grab a piece of hay. So these were the kind of interesting things that we've learned by using those kind of devices. And what also helped us make even more kind of aha moment is um, we have that dust sensor that gives us the level of dust exposure in real time. And then we stuck a small video camera on the sensor to see what the horse is doing. The tip of its nose is doing. So a little drone camera that we stuck there, and then we synchronize, the video with the dust exposure, and we can see, okay, the horse is, and because it's wearable, we let the horse be, and we just, don't disturb the horse, and then look at the data afterwards. And a great example to me is I had a horse, they brought in sweet feed. So the horse like zoom on the sweet feed, goes down, barely any dust exposure. And then they gave hay and put it in what they call, hay savers. It's kind of a tub essentially, and you throw the hay in there, and then the horse goes for the hay dive, and you can see the exposure going sky high right away. Then the horse moves its head away back to the stall door and looks around. Up, now the exposure comes down. It's fascinating to me
So
because
fascinating.
it shows really what is happening. And basically our research shows that yes, the peak are important, etc., but it's also the average, exposure that really determine whether or not the horse will have some response to that. So
Well, on behalf of horse owners everywhere, thank you guys for doing this research because it's the type of information that we need to do the right things for our horses. Like you said, it's easy to assume that maybe a dusty barn is the first thing to tackle, but
mm-hmm.
that's not really um, the thing that is making the difference for these horses. So let's talk more best practices to help avoid causing inflammation, or AKA, let's talk prevention. So you talked about hay being on the ground being better than in a hay net. Um, is pelleted hay the best practice, and what are some other best practices that horse owners should know about to help prevent inflammation?
Yeah, so how can you decrease dust exposure from hay? So dry hay certainly would give you an exposure. Obviously, poor quality hay would be the worst. So if you wet down the hay, you can just cut down any exposure by about 30 to 50%. And sometimes that's enough um, to stop, the problem that it's causing initially. The Wetting the hay down might have its set of issues. You create a wet environment in the stall. If you're in a part of the country where it's hot and humid, you're going to favor fungal growth as well. So it could be a double-edged sword. So you have to manage that aspect. But certainly there are some horses that can be managed just by doing simple things like that. Um, the hay cubes or hay pellets, it certainly cuts down on the dust exposure. We've shown that as well with our studies and others. Um, it has also its set of issues, as you have noted, probably as horses will gobble their feed much quicker. Instead of munching on that hay, overnight or whatnot, they'll be done within a couple hours, and then, they have nothing else to do. And so they certainly, we know they can develop more, uh, uh, you know, stereotypic behaviors and, crib biting and all that stuff. Also, it's been associated with gastric ulcers, so that's something to keep in mind. So it's not for every horse, especially if you have a horse that's a little on the anxious side, and it's pretty better to try the wetting down the hay, so they still have that benefit of kind of chewing on for a longer period of time and have something to do. Um, and so what we actually found is the best substitute for the hay is what we call haylage. So you're pretty more familiar with silage in cows. So essentially it's taking, grass, and instead of drying it all the way down to, let's say 15% humidity is typically what is recommended for dry hay. Well, you actually stop and bale that hay when it's at about 30% or so, 40% humidity. But of course, if it's humid hay, you know what happens if you bale it and you leave it to the air, then mold will start growing. So to make haylage, you actually have to put it in a sealed, airtight, plastic wrap. And that's why, silage for cows, it's covered with big tarp and things like that. So you need specialized equipment to bale those, that wet hay, if you will, to make it a sealed, bale of haylage. And um, and also it can be poked, because if the air come in, then it will mold, in that region. But we've done studies actually in racehorses showing that, even though it decreases dust exposure by about the same as what the steam hay does, that's another thing we can talk about. Um, we found a much greater benefit of the haylage, and and our research is actually pursuing that, but we think it has to do with um, the essential fatty acid that is provided by fresh grass, and those are not available in the cured grass hay, the dry hay. Um, and so yeah, horses on the haylage did much better. And unfortunately, in the U.S., not many people produce haylage, but if you go in
Yeah.
Europe, this is extremely common. And again, because they usually have more trouble producing good quality hay because of the weather conditions, especially in the UK and so forth. And so that's why they've switched to haylage. And so it's got a set of issues as well, but if you can
Yeah.
have access to it, it's a very good forage. Certainly in that respect, better than dry hay. And then
Interesting.
steam hay, as I mentioned, is another approach. There are some commercial, device out there, big suitcase that you plop your bale of hay in there, you steam it for an hour, and then feed to horses. And we've tested that as well in racehorses, and it is beneficial. Kind of sterilizes the hay, but also decreases dust exposure. So that's another option for people um, that can find those and afford those. Yeah.
Okay. Um, Good to know. I want to make sure. I think that I guess the last thing on exposure to dust that I should touch on before we talk about identifying asthma is how do you recommend that people travel in a trailer with hay, or do you recommend no hay if you can get by without it?
Yeah, I would recommend not providing hay during transportation, just providing it when you stop, and because you would have to provide it in a haynet, presumably, and that means the horse will have its nose constantly, especially if the horse is tied in the trailer, in front of that hay, and so we'll be inhaling all these particles, during the trip. So I would say I would try to avoid that, and unless you have, yeah, even steam hay with steel probably lead to more exposure in that way. Um, so yeah, if you can't do otherwise, it's better than to have the horse trailer loose, and not tied up, and put the hay on the ground, which will limit more the exposure that way.
Okay. And that's super. I mean, we never want to cause any sort of like discomfort or issue for our horses, but especially when you think about trailering, people do some decently long hauls and
Yep.
they get off the trailer and shortly after they're asking something pretty significant of the horse. So
Yeah.
being able to especially limit that immediately prior to something like a competition or a clinic um,
So actually,
is
another
definitely
thing related to trailering on the long rides, or long overhaul, trailering horses, what we know very well is just tying the head up of the horse really limits the ability to normally clear all the particles, the dust that it would inhale. Normally, it's gets stuck on mucus, depending where it goes in the lung, and the lung has that as those cilia in the airway that move mucus constantly from deep lung, up And then horses or us, we can cough, we can swallow that mucus, we can get rid of it that way. We know that even if you leave a horse in a stall tied up for 24 hours, past 12-hour mark, they will start showing signs of infection, um, showing even fever at some point, and eventually develop pneumonia just tying the head up because you
Yeah.
prevent the horse from having that normal clearance mechanism. So same for trailer ride. We knew for a long time that long trailer ride both is associated with severe pneumonias and pneumonia in horses, severe infections. And a lot of the time, in the old days, we thought, oh, it's the stress, and it, suppresses your immune system. Well, what we found is, yes, it does that, but on top of it, you stop the normal clearance mechanism by keeping their head tied up. So if you can let the horse loose in the trailer, at least the head loose, and that's much better for their health.
Interesting. Okay. That makes a lot of sense. And okay, I'm gonna force myself to switch to I am so fascinated by this. I could talk to you all day about it.
I'm
Um,
sure. Me too.
yeah, I know. You've dedicated a career to it. I can see why. Okay, tell us. A lot of our members are event riders. There are several other disciplines that people are doing as well, but there's a lot of event riders. Um, I don't know if that makes a difference for this question, but just in case it
Mhm.
does, um, how should people identify whether their horse has asthma so that they can take the right precautions or pursue treatment? What are some signs that would indicate to somebody that they should do a little bit more digging?
Yes. So I would say, a couple of things to look for. Um, One is obviously coughing. Most of the coughs, essentially, cough receptors start in the throat and then go deeper. If you have an irritation in your nose, you don't cough, you sneeze. But if it's, irritated, from the larynx down, it will manifest itself as coughing. And sometimes it's pretty subtle. And I would say not all horses with asthma cough. About 60% of horses with asthma have a cough. That means you still have 40% that do have the disease but do not cough. So don't rule it out because you don't hear a cough. But sometimes the coughing is quite subtle. It might be just at the onset of exercise, and you might, you know, discount that as saying, well, a horse is clearing its throat and whatnot. But I would say that should be your first awareness. And the second thing is mucus through the nose. So if you, and especially after exercise or during exercise, if the horse is exercising, and especially an eventer, after the steeplechase or whatnot, if you have profuse, whitish, discharge from the nose, uh, that's not normal. I mean, having clear discharge is fine. I mean, you have always mucus in the airway, but if you start being, either yellowish, of course, or even whitish and abundant, that would be abnormal. So as veterinarian, typically the next step for us, for example, would be passing the endoscope and checking, is that a normal amount of mucus in the airway or is it abnormal? And then also by looking with the endoscope, we can say if it's inflamed or not, so we can go all the way from the upper airway down to the trachea, the windpipe, and then further down in the lung. Yeah. So that's a common test that we do, and it's best to detect mucus within an hour of exercise. So usually 30 minutes to an hour after exercise, that's when you're more likely to see mucus. You might excess mucus. You might miss it if you wait the next day, for example.
So those are your signs that you should maybe have a vet out and explore this further. My final question
Yes.
is, let's say that the vet determines, yes, this is asthma. I know it's a big spectrum, but on the more mild side, at let's say the lower levels of eventing, what types of treatments will help keep that horse comfortable or prevent it from getting worse?
Yeah, so this could be an whole other podcast, but obviously, as we talked about, obviously talking about what's causing it to begin with is really important because you have many ways to treat as well. But if you don't address the cause, treatment will help, but once you stop that, you'll be back to square one. So it's really important to have a comprehensive approach and really identify what's the driver for this asthma. But essentially, there are often what's recommended, especially for athletes, is aerosol therapy, with a nebulizer, for example, or metered dose inhalers, and so that's recommended because you have much less side effects. It's much more flexible in terms of stopping, starting again. Because if you have a show, you have issues with drug testing. You want to make sure you're safe on that side, and but then you can start right away after the show, for example, and that's not a problem. Versus corticosteroids is the mainstay stay of therapy for asthma, and obviously those can suppress the immune system of the horse, can make a horse more likely to founder, for example, as well. So the safety of the inhaled therapy is certainly very important. But also, we found that what's really helpful is to supplement horses with omega-3 fatty acids. And so that's been something that we are still looking into that very much to find out, refine what type of fatty acids and in what amounts. And but it's been very interesting because we found that by just providing that supplement, sometimes that's enough. And what turns out is those fatty acids often would come from grass pasture. And as you know, horses in the barn don't often see a piece of grass, and sometimes for months. And so they become deficient, and those fatty acids lead to the formation of endogenous compound that help horses normally bring down inflammation, resolve inflammation. That's why we call them, pro-resolving, mediators. Um, so that's a fascinating area of investigation for us right now, and we certainly have shown already that some compounds help a great deal, and hopefully we'll demonstrate that more availability in the future.
Wow, you have, I mean, beyond, you've piqued my interest to such a great extent. Um, it's incredible, and I'm so
Good.
glad that you taught us all of this information. I took 3 pages front and back of notes just because it really isn't intuitive. Like, you have to be taught this stuff,
Hmm.
and we appreciate you so much teaching us. Will you tell me, is there anywhere that people can follow your research or follow you?
Yes, if you go to the Purdue University Vet School website and you go to Equine Sports Medicine, you will have a lot of link to some of the work we do, some of the work from other researchers. We're actually in the process of uh, putting a lot of our scientific publication in more layman's articles. And so that's the beauty of AI now. So actually, I have folks from our website design team, that send me all my articles now condensed into a more intelligible, format. But that means I need to look at it to make sure AI is correct. so,
Yes, true.
uh, but as time goes on, we'll have more and more of the literature, hopefully summarized in a way that's more digestible for folks, and that makes sense, and with less of our, scientific lingo that
Yeah,
sometimes is very confusing. So
I love that, and I'll keep an eye on the website as well so that when those things start coming through, I can share to our community too, because I
sure.
know I know everyone will be equally as hungry for just additional learning on the topic.
Hmm.
You have done such a great job of both teaching and um like I said, piquing interest. So
Good.
this is
Well, I'm
something I'm
glad.
excited to dig deeper into, and we're just so incredibly grateful to you, your depth of knowledge and your just genuine interest in the topic is so palpable, and I just enjoyed talking to you so much. So thank you for
Me
taking the time.
too. Me too, Jessa. Take care. It was a pleasure to meet you and to chat.
Thank you. Have a wonderful evening.
You too. Take care. Bye bye.
Bye.